Number 4, rapid interventions for psychiatric disorders. Major depression is one of the top causes of illness and mortality worldwide, and suicide is a leading cause of preventable premature death. Effective antidepressant treatments for major depressive and bipolar disorders are in short supply, however. While there are many treatment options available to doctors, all currently available antidepressants take several weeks to work, and unfortunately, many patients respond only partially or not at all. Due to the critical unmet need for rapid onset therapies for nearly 7 million Americans with severe treatment-resistant depression, research is now quickly advancing for a host of more precise techniques to stimulate or calm the brain with newer drugs, electricity, magnets, and infrared waves. Several clinical trials with ketamine, an FDA-approved anesthetic, have demonstrated remarkable outcomes in treating depression. Typically, a single application can have rapid and lasting antidepressant effects in patients who did not respond to other therapies. Because ketamine is an antagonist of NMDA-type glutamate receptors, expanding research is now focused on the role of glutamate neurotransmission in depression and on other drug development programs that specifically target the glutamatergic system. Study results of patients suffering from depression indicated that many of them who breathed nitrous oxide, also called laughing gas, reported a rapid and significant improvement, with most noting that they felt better only 2 hours after inhaling the gas. That compares with at least 2 weeks for typical oral antidepressants to exert their beneficial antidepressant effects. Non-invasive devices are also being tested for their ability to trigger rapid treatment response or depression. Low-field magnetic stimulation therapy has been given to provide quick relief from depression non-invasively through an electromagnetic coil that surrounds the head. Sham-controlled data with this therapy indicates an antidepressant response within minutes for patients who received a single 20-minute treatment. Interestingly, no side effects were reported.
So rapid drug intervention, rapid gas intervention. Maurizio Fava is here to tell us more about this. How will they be used? Will it be used just for rescue, as a primary therapeutic? Would you use them still later on in follow-up? Will they be combined with other more standard meds and treatment of a patient as well?
Well, I think that these rapid interventions will change completely the paradigm of treatment of depression. Right now, if someone with acute depression and suicidal ideation goes to the emergency room, gets admitted to the hospital, gets started on antidepressant, which will take, the antidepressant will take 5, 6, 7 weeks to work. So many patients are discharged home and they're still quite symptomatic after a week or 10 days. So the ability to access new therapies that will get you better within 24, 48 hours will change completely how we treat patients. Now, will they become kind of used as kind of ongoing treatment? We don't know, but certainly a very kind of useful use of these treatments will be in emergency medicine settings, in acute inpatient units, where the need for a very rapid intervention is clearly there, and they can be revolutionary.
How about magnetic and electrotherapy devices? Will they someday be replacing standard meds for patients, or have a large role?
Well, I think we mentioned the low-field magnetic stimulation, which is currently being developed for depression and bipolar disorder. Those treatments, if they have a rapid effect and they maintain the usefulness over time, they could potentially replace antidepressant therapies for those patients that actually like the idea of having kind of a non-pharmacological approach used with them.
Thank you, Maurizio.